These are unprecedented times. Each day we learn more about COVID-19 and how the pandemic affects the lives of children and their families. In the plan for the return to school, early educators and program leaders must be prepared to meet the diverse needs of children and their families and consider the pandemic's impact on children's development. Leading psychologists have warned of the significant increases in mental health concerns following COVID-19. They have cautioned that the impact of COVID might create a need for mental health services for all persons and an even greater need among members of marginalized racial and ethnic groups and those living in poverty. The pandemic is described as creating multiple toxic psychosocial stressors that adversely affect mental health. While there's much to learn, here's what we know. The pandemic has affected the social emotional well-being of young children and their families. In a study conducted during the first spring of the pandemic and published in Pediatrics, researchers reported that hourly service workers with young children reported daily negative mood increases and increased hardships. The greater the hardships, the greater the impact on family well-being. Families with multiple hardships, such as job loss, illnesses, caregiver burdens, had more negative moods, worse sleep quality, and reported more uncooperative behavior in their children. In a national survey of families conducted in June of 2020 and published in Pediatrics, 27% of families reported that their mental health had worsened and their children's behavior problems had intensified. These effects were greatest with families of young kids. Dr. Phil Fisher and investigators with the University of Oregon have been conducting a weekly survey of 2,400 caregivers from households with children under 5 since April of 2020. Their data offer a window into how families and young children are faring during the pandemic. Of particular importance are the following findings. Families and households of children with disabilities reported greater stress, including greater caregiver anxiety, caregiver depression, child behavior problems, and child anxiety. The rates of food insecurity were high, with 28% of families reported being food insecure. Rates of hunger were higher for Black and Latinx families, single parent households, and households including a child with disabilities. Caregivers and families experiencing hunger reported high levels of behavioral issues with greater levels of fussiness, defiance, fear, and anxiety in their children. Families with children with disabilities also reported significantly fewer preventive healthcare visits for their young children due to their inability to get away from work, to find childcare, the demands for caring for others, or their concerns about COVID exposure. This reduction of well-child visits may lead to negative physical and behavioral health outcomes as child development screenings, vaccinations, and pediatric guidance are delayed. The hardships that families face have been devastating to their economic stability and stress. We know those hardships will directly impact children's well-being. It is well established that children's exposure to adversities in early years can lead to a lifelong impact on children's physical and emotional development. We should be ready to address the trauma, behavioral, and social emotional needs of children when they return to school. Not all children will be affected in the same way, and not all adversities that children experience will result in trauma. But being ready, with universal practices that are supportive to children who might have these symptoms will be critical. We also must be ready to support families as they cope with the challenges that are confronting the family system. There are practices that early educators can use that strengthen the protective factors of the child and contribute to the child's resilience. Teachers should work hard to establish a nurturing and reassuring relationship with the child that provides a feeling of security and trust. Enhancing predictability in the classroom also increases a child's sense of safety and helps children navigate classroom routines and interactions. Providing instruction on key social emotional skills, including strategies for emotion expression, self-regulation, and problem solving. Finally, supporting family wellness and building their capacity to support the child. The recommendations for educational programs related to becoming trauma-informed by the National Child Traumatic Stress Network are directly aligned with the implementation of the pyramid model for early childhood programs, including the use of a multi-tiered approach, prioritizing nurturing and responsive relationships, teaching social, emotional, and behavioral regulation skills, and addressing behavior through seeking to understand the behavior. In the use of a trauma-informed care approach in the pyramid model, we pay more attention to providing secure relationships and predictable environments. We assist children with strategies to regulate and cope with strong emotions. And we consider the context of family and trauma in our assessment-based behavior support process. All staff receive training in trauma-informed care. NCPMI has provided many practical strategies for teachers to assist children, including expressing feelings, calm down and relaxation strategies, self-regulation or the management of strong emotion, and social problem solving. On NCPMI, you can access a list of those practices and how they are used in a trauma-informed approach. We also provide resources to use in the support of families. We recommend that early childhood personnel consider how they might enlist the support of an infant early childhood mental health consultant. These professionals can assist with access to the mental health system of care, guide decisions about identifying needs and resources, and assist in addressing these critical needs by bringing services and perspectives that will help you more fully meet the needs of children and families. We consider the issue of meeting the needs of children exposed to trauma and families with mental health support needs as one that requires all hands on deck. It cannot be the domain of only one professional or kind of service. We need everyone working together. We invite you to access the many resources offered by the National Center for Pyramid Model Innovations that help early education practitioners and leaders implement these recommendations and address these critical concerns affecting young children and their families.